Rick's List, CNN weekday afternoons, 3 Eastern.
A decision that affects people who have type 2 diabetes. If you or someone you know in your family does, there is a possibility that they are taking a certain drug. It's called Evandia. And there's a very important decision to share with you on Evandia that could affect you or one of your loved ones. So joining me now is Caleb Hellerman. He's one of CNN's senior medical producers. He heard about this information and hustled down to the set to catch us up. All right, who made this decision and what are they saying about Evandia?
Hey Rick, this vote came at the end of a 2-day meeting of an FDA advisory panel. These are experts in the subject. They talk about diabetes, endocrine disorders, and also drug safety.
Right.
Listening for 2 days to people, to reading reports, hearing about Evandia. Does it have a link to heart problems? And this advisory panel just came out with a kind of strange vote. There's 33 people on it. 12 of them said to pull it off the market. Another about 17 people said they need a stronger warning or it should be restricted where maybe only certain doctors can prescribe it.
So it sounds like everybody on that committee is giving some kind of cautionary tone about Evandia. Whether it's pull it off the market or this or that, it all sounds to me like if I was taking the medication, I'd want to know what they say.
Absolutely. They were all very concerned about it. I mean, they were a little confused, but they were very concerned, and actually the biggest vote was to pull it off the market.
And again, it's that this drug is prone, not guaranteed, but there's a possibility you could have a heart attack if you take this.
Absolutely. There's been some, that's the concern, not proven. That's what they were arguing about.
Why has this drug been on the market? I mean, this is not new information. We've been hearing this for some time. Why have they been able to continue to have this drug manufacturer? Who's the lab on this, by the way?
It's GlaxoSmithKline.
Why have they continued to keep it out there?
Well, the critics are saying exactly that. I mean, the big blow-up came in 2007. There was an article in New England Journal of Medicine said this causes a big increase in heart attacks.
So they denied it.
And the company, meanwhile, said, hey, we got 6 studies saying, no, it doesn't. It's fine.
If I have diabetes and I'm now taking Evandia, is there another drug or are there other drugs out there that I can take that would be proper substitutes?
Yeah, I'm not a doctor, so obviously this is the kind of thing you want to talk over with your doctor, but there are quite a few other drugs on the market. Probably the most people, I think, take metformin. There's also a very similar drug to Evandia called Actos, which acts very similarly, used for the same types of patients.
Point is, they're not out in the cold. These folks are not out in the cold. There's other stuff out there that they can use.
A lot of doctors just say better safe than sorry.